Evening. Thanks so much for joining us and for your interest in hopefully in our program. I'm Dr. Marilyn Howarth. I'm an occupational environmental medicine physician, and I'm the deputy director of the Philadelphia Regional Center for Children's Environmental Health. I'm joined tonight with my colleague Jerry Roseman, and I'm going to turn it over to Jerry to have him introduce himself.
Thanks, Marilyn. I'm working with the PRCCH, and I'm the Director of Environmental Science for the Philadelphia Federation of Teachers, Health and Welfare Fund and Union, and with the Philadelphia Healthy Schools Initiative. And my work involves looking at school conditions, visiting schools, and taking a look at asbestos conditions, and in helping to write the reports that we're going to be talking about during the evening.
Great, thank you. So from this slide, you can see our Children's Center is a collaborative effort between the Perelman School of Medicine at the University of Pennsylvania and Children's Hospital. Next slide. Our purpose, the reason we exist, is to improve children's environmental health by reducing environmental exposures that they have in all kinds of realms. And we work with all of these other universities. We have researchers and doctors and clinicians in all of these places. And we try and work together to think through how to research and also change and improve children's environmental health. Next slide. These are some of our focus areas: lead exposure and harm reduction, air pollution, asthma, endocrine disrupting chemicals, and climate change, some of the key issues that children in our region face. And we work on these things through pilot projects and translational programs and other things. Next slide. So the reason we're talking about asbestos tonight is that several years ago, there was an awareness, and an awareness that actually was very troubling, that many schools had damaged asbestos, and it was clear that parents, teachers, staff really couldn't assess on their own the publicly available information and to know what was the situation in their school, their child's school or the school that they worked in. And so we recognized that this level of angst among all stakeholders who may or may not be exposed was really not good. And frankly, we did not see the school district um, translating these technical reports that they had to do for the EPA. And so we thought perhaps this is something that we can help with. So we've created asbestos hazard reports for teachers, staff, and parents about the individual schools. And we are doing them on an ongoing basis because there's constantly change and there's constantly new information available. So we didn't want to do them all ahead and then have them be not correct when we rolled them out to talk to people about it. But we're going to talk tonight about what's contained in the report and why it might be useful. Next slide. And to talk more specifically about asbestos in general, I'm going to turn it over to Jerry now.
Thank you. The big question about the asbestos is in schools is it dangerous? It does exist in most of our buildings or in many of our buildings in many locations. So is it dangerous? And we kind of thought that it made sense to have a better understanding of what this is. What you're looking at here is asbestos, the miracle fiber. On the left-hand side, you see this fibrous mineral material. And on the right-hand side of this, you see an image that represents fireproofing material sprayed onto steel beams. And what's happening is the asbestos itself, which is again a mineral fiber, is mixed in with other products and then applied to surfaces in different concentrations. Next slide, please. One of the major issues that we're worried about is are those fibers that now get mixed in with other materials, are they able to get into the air and to be inhaled? Because this is really what we're concerned about. Airborne asbestos fibers. This material that you're looking at is pipe insulation on the horizontal section. It's covered with some silvery aluminum wrapping, and then you can see as it moves to the right and moves and covers this fitting, this irregular shape, that you see what looks like a canvas wrap and some white material. So this is asbestos. It is damaged, and it is what we would consider to be a friable material. So this is something that we're worried about when we see this in a school. Next slide. Here you were trying to give an idea of the range of materials that asbestos is found in. And you can see the list on the left, and you saw the pipe insulation and the fireproofing in the previous slides. You can also see that asbestos has been mixed in to floor tiles, that's on the right side. It is used in front of radiators, like you see on the top left, as a material to act as a heat insulator on the inside of the covers for these radiators. And at the bottom, you see two images showing ceiling materials, in one case plaster, in one case paint. And these materials both contain asbestos as well. The difference between some of these materials is in their level of damage, more risk, and their level of friability, more crumbly, more risk. Floor tiles, not very crumbly, plaster and paints, much more so. Next, please. This will be the last slide I talk about, and then I'll turn it back over to Marilyn, and we'll come back and look at some more images later. As I was saying, and is really the focus of this, is, school districts have, and our school district has a lot of asbestos in a lot of spaces. And the basic idea is to try to manage it in place, meaning, do we know where it is? Do we know exactly where it is? How much material are in those places, and what the conditions are, and can we manage it in place so we do not get fibers into the air that can be breathed in. Fibers that do get into the air remain there for a long time, settle out, can be re-entrained back into the air, people walking around, moving around, sweeping floors, and can be on desks and other surfaces, so can cause a constant inhalable problem. Next slide. And you, Marilyn.
Yeah. And so, what kinds of health impacts do being exposed to asbestos cause? Well, you've probably heard that asbestos can cause cancer, lung cancer in particular, but also the larynx and the ovary. And there's one kind of cancer that is very specific to asbestos exposure, and that's mesothelioma. But mesothelioma is not the only cancer. All regular lung cancer, the same kind that's caused by smoking, can also be caused by asbestos. You may have also heard of a disease called asbestosis. That is also from asbestos, but that is a condition that occurs with long-term, very heavy exposure, the kind of exposure that workers would have in a plant manufacturing items using asbestos. And so that kind of exposure, that kind of condition is not what we have in schools. So we would not see asbestosis from people working or learning or teaching in schools. Similarly, we don't see any acute kinds of symptoms. So no one's acute illness is related to asbestos because the nature of the asbestos exposure is much smaller than would be in a plant type or manufacturing setting. Next slide. And the risk of getting lung cancer or any kind of cancer from asbestos is much greater in smokers. We know that smokers have a 15 to 30 times the risk of developing lung cancer, period. But when you add asbestos to that, it really does increase a lot. 1 in 16 men in the US, and 1 in 17 women will develop lung cancer in their lifetime. And the reason I'm commingling, if you will, of smoking here is it's often very difficult to know. It's in fact nearly impossible to know exactly what caused someone's cancer. We know that smoking obviously contributes some significant carcinogens, but in many of those smokers, they may also have had asbestos exposure, and so asbestos might be the real culprit for some people. Next slide. And those cancers happen over a lifetime. Cancer in general has a long latency period. In other words, you might have an exposure and then it might take 10, 15, 20, or longer years before you'd actually develop cancer. And that's absolutely true with asbestos. But I want to point out that it's not just the asbestos that someone might experience in a school setting, but they may have asbestos in their neighborhood. Maybe there was a demolition on their block of a building that was loaded with asbestos and perhaps wasn't handled exactly right. Maybe they have asbestos in their home, or maybe they've brought it home from work or working with it. But all of these things, our bodies really don't care where that asbestos comes from. Every time we breathe in asbestos fibers, they tend to lodge in our lungs and they stay there. We're not able to actually break them down over time. But our immune systems do continue to work on them to try to break them down, although we're not successful. And it's in that continual action that the cancer evolves over many years. Next slide. And I'll turn it back to Jerry.
Okay. So again, focusing on the exposure and the risk, we have an enormous population at risk. So although each individual risk in a school may be quite a bit lower and is quite a bit lower than it would be in a factory setting or some other setting, we have a lot of very vulnerable people. And what you're seeing here is a photograph that I took in a school gymnasium where you have children who are sitting directly near and in very close proximity to asbestos covered pipes. And so one of the main risk factors that we pay attention to is the accessibility of asbestos materials, even if it's in currently good condition, to children and others. When you look at the left-hand photo, you're seeing a minor damage, but one that releases fibers in the air in some pipe insulation. And on the right side, you see a way too common problem, asbestos covered pipe in a closet that is meant for classroom materials. So these situations, not manufacturing situations, are actually very significant. Next slide. So we talked about accessibility just a second ago. We've talked about friability, how crumbly it is. We've talked about damage. The other is activity, and you start to combine these kinds of things together. So here, along the sides of the hallway on the left, you see asbestos covered pipe insulation, and you know that this hallway is going to have 100 children in it jostling each other and walking through at one time. So there's a lot of activity there. In the middle, you're looking at a gymnasium, and what you're seeing here is asbestos pipe insulation again, a friable material. You see some sampling pumps because sampling of the air in this area is going on. And this is one of the settings where we had a very unfortunate kind of situation in which a teacher, a long-term teacher, did develop mesothelioma a few years ago. This is the school that this teacher happened to be in. And the kinds of exposures we saw in the school were both concerning and not very atypical. On the right, at the top, you're looking again at a closet situation where there's a lot of activity with materials in and out, and then a cafeteria. So this is a lot of what we see in our schools. Next slide. These images in the left and the middle show what is fairly significantly damaged asbestos containing materials that are friable. In both cases, they are underneath the ceiling. In one, on the left side, they're almost completely above a drop ceiling and so concealed. In these settings, water intrusion through roofs, we have an old infrastructure with a lot of damage. So water intrusion from roofs, leaks from antiquated heating systems can damage and have damaged this asbestos material. It can drop out and cause fiber releases in the spaces in a hard to know way. It can also contaminate the tops of ceiling tiles, which when later removed as part of maintenance efforts, cause further exposure to occur. On the right hand side, you're looking at floor tiles, a more minor condition, but as these tiles start to get broken, damaged, they can start to crumble. The mastics and glues that hold them in place crumble, and you can also have exposure that occurs from damaged floor tiles. Next, please. Again, further images that are meant to show in the middle, you're looking at the list of the kinds of materials in a school. So when you look at the AHIRA, these asbestos reports, which we will in a second, these kinds of materials are the ones that are highlighted. On the left, you're looking at wall plasters, and you can see how degraded and crumbly these are. That's intensely friable. And when you're on the right side, you're looking at insulation materials that also are quite damaged and also friable. Next slide, please. There are different percentages of asbestos, the asbestos itself, in these different products. You can see what they are. They're bound up in different ways. And the thing to know is that anything that is more than 1% asbestos is considered an asbestos containing material. And we don't really distinguish the risk based on the specific percentage. It's based more on the condition, the proximity, and some of the other factors we looked at. But you will see that pipe insulation and plasters and drywalls contain more asbestos than floor tiles and roofing materials. Next, please. This is what it looks like when asbestos is remediated, and this really is just giving you a sense of how serious it is once you start to actively and directly touch these materials. You don't want to have any asbestos in the air, and what this is showing are varying kinds of containment areas and setups that use plastic sheeting floor to wall. On the right-hand side, you're seeing an entranceway that contains a shower area. And you can see the walls of this plastic kind of pulled in. That's because inside the asbestos area are large ventilation air cleaning units that suck air toward the work area to make sure nothing escapes during the work. Next slide. This is the last one I'll focus on. This is actually more of a vision test. So everyone take a few minutes to read it, and I'll ask you what you can see. This actually is the document, sorry about that, the page from a page from the document that PRCCH is looking at very carefully to abstract information, summary information, to help people understand what's going on. What I'm going to point out here is that there are 12 columns and multiple lines. Each line, and it may be a bit hard to see here, I'm not sure how easy it is to see this. Each row is an area. You can see, let's look at the top for a minute. Hallway from classroom 306 or 305 to 307. That's repeated a number of times because associated with that is a material description. The same area, plaster ceiling, concrete floor, plaster wall, and so on. And you can see in the column that says amount of material, how much of that type of material is there. I'm going to stop here in a few seconds, but I just want to say that when you look at the column that is between the material description and the amount of material, it's telling you if it's asbestos or not. NAD is no asbestos detected. So in that plaster ceiling at the top, there was a sample collected, and that's why you can say no asbestos was detected. If we don't think this stuff is asbestos, like a concrete floor or the fiberglass pipe insulation or windows, that kind of thing, we say there's non-suspect material. We show it, but we say that. As you scroll down to the bottom and look at it, you can see 3 rows where it says confirmed. It says confirmed. Those are all for pipe insulation. That means that they were suspected, they were tested, and they tested to be positive for asbestos. So you can see the kind of categories. The one category missing that you will see in our summary reports is something that is called assumed asbestos containing material. That is material that we believe to be likely asbestos or maybe asbestos. We didn't test it. Until it's tested, we act and treat it as if it is an asbestos material. And were it to become damaged, it should be handled the same way a confirmed material was. It's considered assumed until tested. If not tested, it's treated as confirmed. Next slide.
So I think you've heard in the way Jerry was talking about this, that it's not so straightforward or transparent when you look at these reports exactly what's going on. You really need to have a fair amount of insight. And fortunately, we have Jerry on the team who does have that level of insight. But what we wanted to do was look at publicly available reports, translate them for people, and then answer questions and help people know what intact asbestos looks like in their school and what damaged asbestos may look like so that they could be on the lookout for it. Because unfortunately, these things change and they're not removing asbestos from schools in general. So it will continue to be there. And wouldn't it be great if everyone was knowledgeable about how to make sure that it remains intact? So what we do is we review these HERA reports. They're on the school district's website. We analyze each entry for whether where the asbestos is in the schools, whether or not it's damaged, whether or not it is a friable material or a less friable or not friable material, and whether it's been damaged before. If we can find an earlier report and find that it's been repeatedly damaged and fixed, that would be important to know. And then we also consider the activity level of the location. What we do not do is independently verify the findings. We are not asbestos inspectors and we have not done that. We don't seek out any information that's not publicly available. And we can't verify what asbestos materials have been remediated by the school district since the release of that AHERA report, because those are not made public on their website. Next slide. So just not to get too far into the weeds, our full methodology is on our website, and we will leave you with our website link so that you can go there yourself if you'd like to read all this in detail. But basically, we went through an entire decision logic about if the asbestos is not damaged, in what circumstance are we still concerned about it? If it's friable, and then there's still a moderate risk and should be monitored frequently. And if it has the potential to be damaged, in other words, it's in a very area impacted by vibration or lots of kids, we still want to have it monitored frequently. Next slide. And if the asbestos is damaged, the asbestos containing material is damaged, again, we ask the first question, is it friable or not? If it's friable, if it's located in a hallway, bathroom, classroom, the place where the children and people are all the time, then we consider that a high risk material and it should be remediated immediately. If, on the other hand, it's not friable and the quantity of the material is not the quantity the material. Let me say it again. The amount of damage is not a high quantity in that material. It's less than 10%. Then we consider that a low risk. But if it's a lot of damage, it may become as significant a risk as if it were friable. So we consider that a high risk material. Next slide. So let's walk through what a report might look like. We've selected an undamaged report, and I'll point out the spots where a damaged report might be different. So we start out about explaining exactly where we got the information, and we have our key findings. How many occupied spaces have asbestos-containing materials. How many of those asbestos-containing materials are friable, and how many are damaged? And so you can see from that bar in the middle that those are the key findings in this particular report. And then under that, it has our recommendations, whether or not something should be fixed immediately, or whether or not it should be watched, depending on where it is. Next. This is some general information about what is asbestos, what are the health effects, are all asbestos-containing materials of equal risk? And you already know the answer to that. We just talked about it. They aren't. Um, and how damaged is it, and how should that be managed, with some definitions. Next slide. And then we get into more detail about the particular school. So in this case, we again talk about the number of places where we found asbestos-containing material, and where a little more detail about where they are, and why we think certain of them are important, or we think that they are really not in places that are likely to be damaged. We give a QR code to get you right to where the AHERA reports can be found, and so we make it easy for you to look at this information yourselves. And we also would like teachers, staff, and parents to be vigilant. If they should see something in a school that they think represents damage, we would very much like them to download the app that's in the other QR code here. And it's the Hazard Conditions Healthy Schools app. And this app collects information about where damage is found, and feeds it to the school district, who then will take action. And Jerry can speak more about how successful that's been, but it's my understanding that it's been quite successful. Next slide. And then we have two tables. The first table lists for that school every single location of friable asbestos-containing material. So you can find your classroom, the places you go in your school, and look to see where that friable material is. And then you'll see on this particular report, the rightmost column seems like it's all blank. And it's true, it is blank. It's blank because none of it is damaged in this school. It is all in good condition, according to the AHERA report. Next slide. Table 2 similarly documents the location of all of the asbestos-containing material that is not friable. And again, in that rightmost column, reports any damage. And again, you'll see that in this school, there is no damage. So in a report that would be talking about damage, there would be details there. There would be details about, the damage. If we have learned that it might have been remediated, or any details about that, we would log it there. Often we don't know that. Next slide. And so what should we ask? What are we asking, and why are we doing these reports? We really would like everyone in a school setting to read the report and know where the asbestos is located in their building, and know how to look at it and decide whether or not it's intact. If the asbestos becomes damaged, um, immediately informing the building engineer and/or principal, and encourage the school district to make these reports on school inspections and work notices available in a more timely fashion. It would be great if there was some kind of document that told us that, yes, in fact, these things were fixed, and we could document for you, yes, the school district said that. But right now, we do not have that level of transparency. Download and use the Healthy Schools app to report any unsafe conditions in schools, because it really does work to get them fixed. Next slide. And so we are asking everyone who's on our call tonight to be the link for us to your school. If you'd like to have a report done for your school, we would we would ask you to let us know. You can volunteer tonight. You can contact Isabella Andriozzi, who's also with us tonight, but here's her phone number. If you'd like to see more about our project and the information that we provide, feel free to go to this website, either through letters or